I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida. Here to discuss is how to cope with someone who has manic depression. Manic depression today is referred to as bipolar disorder. Manic depression, though, nicely describes the disorder because it's a mood disorder. In the manic side and the mania side, it's an elevated mood. And in this elevated mood, you oftentimes see a kind of an inflated sense of self, kind of a grandiosity. A lot of creativity oftentimes occurs in this state. People feel like they can do a lot, walk on water, so to speak. In this manic state, unfortunately, in a more severe manic state, people will begin to engage in fairly high-risk behaviors, whether drinking, drugging, a lot of indiscretion regarding sexual practices. So the mania piece in a hypomania, which is a less severe state, can be a pretty nice state for folks. They're fairly motivated, high energy, don't need a lot of sleep, creative and all that. In a more severe state, you tend to get a lot more of these very destructive behaviors. The depression, state of manic depression, is not much different than any other type of depression. A sense of hopelessness, a sense of helplessness, low fatigue, low energy, almost the opposite of the manic state. But in this state, people tend to kind of lose interest in a lot of pleasurable activities, be it things, avocational interests that they liked, sexual activity. It doesn't really matter what the loss of pleasure is. So you have a manic state and a depressed state. So how do you cope with folks who are experiencing manic depression? One, educate yourself, better understand what manic depression is. Certainly assist them to seek out treatment. In this case, really a psychiatrist for the medication and a psychotherapist who practices cognitive behavior psychotherapy for the therapy component. Be patient, be understanding, compassionate. Boundaries are important when dealing with people who are manic depression because they tend to, what I call oftentimes are nudges. They tend to kind of be in your face, so to speak, have trouble with boundaries. But do understand it is a disorder, and a lot of what they do is difficult for them to manage. Well, hopefully I've provided some helpful information regarding how to cope with individuals, folks who have manic depression. From sunny Tampa, Florida, I'm Dr. David Thomas.